Next, we're going to go ahead and cover trigger point therapy on the levator scapula. The levator scapula's origin is off the transverse process of the first 4 cervical vertebrae, so C1 through C4, and it inserts onto the superior medial aspect of the scapula here. So the levator scapula helps with, it actually performs lateral flexion of the neck, some rotational component, I believe, as well as elevation of the scapula. So this would be a fully contracted position for the levator scapula. We're going to lengthen it. So I tend to use a thumb contact when I'm working along the levator scapula rather than the traps, just to be more specific with my contact, since it's not as large and fanning muscle as the trapezius is. And then I'm gonna have Kristen take her arm. She's gonna grab the side of the table here. That just helps to depress her whole shoulder blade, which is the opposite of the function of the levator scapula, which is to elevate the shoulder. And then I'm gonna bend her to the side as I take a contact on her levator scapula near its insertion point here. And I can even add some flexion and rotation with this. And I can start as high as these cervical vertebrae here. When I'm up in the cervical vertebra, sometimes I use my thumb, sometimes I use my fingers to work these trigger points here. And then more so when I'm down at the base of the neck or the superior medial border of the scapula here. This is where I find a large majority of the levator scapula trigger points. This is when I am using my thumb contact. And we're even getting some large muscle jumps here in Kristen. This area is especially important to address in patients with frozen shoulder because this muscle tends to be recruited when there is limited shoulder flexion, and instead they'll kind of give themselves a pseudo boost in their range of motion by elevating the shoulder so that they can get their arm higher.